Hi students, I am Dr. M. Ashraf Majrooh, Professor of Community Medicine. I welcome you in the learning session of Public Health Laws. The agenda of this session include Ethics and Philosophy of Public Health Laws, Constitution, Laws and Public Health Actions, Implication of laws in public health emergencies of national and international concern, Implication of public health laws in protection of health and environment, law enforcement tools and modalities. The first agenda of this session is ethics and philosophy of public health laws. Public health laws are predominantly rooted in social philosophy of utilitarianism. However, deontology theory is working for informed and voluntary choices for healthy behaviors. Utilitarianism philosophy considers an action as morally right if its outcome or consequences are good for the greatest number of the people. It focuses on the greatest good for the greatest number. On the other hand, deontology's social philosophy is opposing utilitarian view in a sense that moral obligations are person-centered irrespective of its consequences over the large people. So, the theory of utilitarianism, the social theory, is predominantly working in the implication of the public health laws. Ethics, how the individuals or the people in society decide right or wrong, is defined as the ethics. Ethics are evolved in the society through the values, norms, customs, beliefs, taboos, religions, and law of the states. All these factors they model the ethics, and ethics are based on strong principles. The sense of beneficent mean making good for the others, and non-maleficence mean not harming the others based on the justice or principle of equity, and it provides the autonomy and freedom of choices. So the ethics are based on these factors, and they are based on these principles. Let's see the association between the ethics and the public health laws. The behavioral change in public health in pursuance of a healthy lifestyle and behavior of the individual and communities. Secondly, the healthy environment, safe and secure planet for the nations. Uh, these are the goals and objective of public health. Now, how the ethics they are we are to do. On the other hand, the law of the state, it is actions, those actions which we have to do. There are some ethical dilemmas where we think what to do, and we will discuss more about the ethical dilemma in the forthcoming slides. But this is the relationship of social ethics and ethical dilemma and laws, and there must be somewhere harmony between the ethics and laws for the resolution of the ethical dilemmas. Now we define the ethical dilemma and the laws. The ethics are undocumented, socially accepted principles to decide between right or wrong, as we have explained in the last slide. Ethical dilemma, a situation in which a difficult choices has to be made between the two courses of action, either of which entails transgressing a moral principle. Then laws are laid down documented principles of the state, decide between right or wrong. It provides the basis of the justice. Now, the behavioral change intervention in public health are important, and the behavioral change interventions are desired. They are focused on the voluntary choices or on the enforcement of the behavior. Both these two are required, and the support is required from the health professional. We can say that on one side there are informed choices on the basis of morality and ethics. On the other hand, the public health laws, these are the legislative measures and these are the behaviors that have to be enforced by the state. On the other hand, the medical care and support is required for health restoration. Let's have some explanation. People are educated and informed about the consequences of behavior on health. The people have informed choices on the ethical or moral basis. So the first priority of the public health that the people must have the behavior conducive to health on the basis they themselves on voluntarily they should adopt that behavior. But when this is not working, then the second option is the people are bound to adopt desired behavior through legislation to protect the health of the community, environment, food, water, and sanitation. So, this is on the second choice when the people are enforced to adopt the desired behavior which are harming not only the health of their own but the health of the other people. The medical care is side by side supporting. The people are supported and enabled to adopt the desired behavior that are conducive to health. The services are provided through healthcare professionals. So this is the triage of the behavioral change interventions, and the key pillars are the moralities, the enforced environment, and the supportive environment. So these are the public health interventions, and we will see the implication of public health laws in the public health interventions. If we think about the situation, can the people live in utopia of morality and ethics without harming the health of the other people? Certainly, it is not possible, and the state is responsible to protect the health of the people and the environment of the environment on principle of beneficent and non-maleficence. However, the state is responsible for justice and set the boundaries of autonomy of the people in order to achieve the greatest beneficent and non-maleficent of the people. So this is the basic philosophy under the public health laws. It has to create the balance between the state responsibilities in the greater interest of the people, and on the other hand the boundaries of autonomy and justice have to be balanced. The privacy, autonomy and public health laws, the situation arises when ethical acts or personal choices are uh, com- compromises by exercising by laws in greater benefits of the individual families and group of people. The actions that transgress the autonomy are the quarantine, detention, isolation, and restriction of movement to prevent the spread of communicable diseases. So, if we analyze these actions, The ethics demand autonomy, beneficence, non-maleficence, justice, or equality. On the other hand, the ethical dilemma arises when the laws they transgress the autonomy and the privacy through their actions um, at the cost of non-maleficence and beneficence. These ethical dilemma arises in the pursuance of implementation of public health actions like quarantine, detention, isolation, and home restrictions. So, this is the dilemma where the public health laws they transgress the autonomy and the privacy of the people, and the state have to take the action in the greatest benefit of the people. So these ethical dilemmas are resolved through the public health laws. Then we have to differentiate between the laws and the conflicts. Laws provide the laid down standard of the acts for provision of justice and to aggrieved parties. The conflict are mismatch of interest and the argument between the goals of different parties. A decision which is favor for one in turn and to be disadvantage for the other. So this is the conflict. The legal process, the conflicts are contested through the formal judicial system under the law and the regulations. So this is the philosophy and its association with the um, ethics and public health laws. The next agenda is the constitution, law, and the public health actions. Let us see the constitution. A constitution is primarily a set of rules and principles documented and ratified by public health representatives, specifying the how a country should be governed and how power is distributed and controlled, what rights of the citizens are retained, where the ultimately where ultimately the sovereignties are located. So this is the constitution. In comparison to constitution, under the guidance of the constitution, there are laws. The term law in general refers to the set of principles standards to be followed. It may be in the form of acts and ordinances. The acts and ordinances are the subset of the laws. Now, what are the acts and ordinances? An act is a law which is made by the legislative bodies like Parliament or State Legislative Assembly with due process of approval. Bills are the draft of the acts to be presented for the approval in the legislative body. Ordinances are temporary laws that are circulated by the President office on the recommendation of the cabinet. So ordinances are temporary, but these are the formally ratified and approved laws, acts. And then, if we see the relationship, the Constitution provides the overall power center and the overall protection to the laws and acts, ordinances, regulation, and rules. All the laws, acts, ordinances, regulation, and rules are under the Constitution. So, what is the Constitution? Constitution defines overall powers of distribution and domains of the sovereignty in between various pillars of the states. Then principle and the standards to act that provide the basis of the justice are known as the laws. Laws are under the guidance of the constitution and the acts and ordinances as already explained they are the subsets of the laws. Laws are framed and documented in the form of acts and ordinances as already defined. Then the regulations refer to the directives or orders enforced by law in a particular country. On the other hand, rules are more minor details. The principles that govern the conduct or behavior of the person in an organization or in a country. So this is the overall structure of the Constitution, acts, laws, rules, and regulations. Now, the scope and level of public health law implication. The public health law not only restricted to the national level, but they are internationally prevailing, like uh, the international health regulation. And the international health regulation come into the play when there are public health emergencies of international concern and there is integrated disease surveillance and response and for the information sharing. International trades and travel policies are governed under the international health regulation and environmental impact sharing is also carried out through the IHR. At national level, the constitution laws, the disease surveillance and public health emergency of national concern, routine life activities, services, and provision of utilities, travel and trades, and also the protection of environment are under the domains of public health laws at the national level. At provincial level, the provincial acts and ordinances are ratified through the provincial assemblies and they are then implicated for the disease surveillance within the provinces and the cities and provincial food services and other utilities and for the protection of environment and trade and travels. So these are the provincial basis of the laws and then district municipal regulations are at the district levels for the marketing of food, dairy, water and sanitation and environment. So these are the various levels where the public health laws they are implemented. Now, what are the domains of intervention of public health? And on this side, these are the domains, and on this side, the modes of intervention. And if we see, the first domain is the public health, dealing with the public health emergencies, and this includes the disease surveillance and disease alert warning. And these modes of intervention are the quarantine, travel restriction, detentions, isolation, restriction of crowding. On the other hand, the routine service provision and utilities, the food process and services, housing and amenities, occupation and trades, including the environment. Here, the standards are set in Pakistan. The Pakistan Standard Quality and Quality Control Authority has been established for setting the standards, issuing permit and licensing through these standards, monitoring and inspection of the facilities. Administrative orders and penalties are imposed when the standards are not met, and then judicial review is also given, and the parties can contest the litigations. So this is the routine provision, and these are the action how the public health laws they are acting. Environmental protection is a very important field, and industry emission and water and sanitation. These are the major areas. Here, the quality standards are set in Pakistan Standard uh, and Quality Control Authority, the Chemical Substances Regulation, monitoring of standards, environmental impact assessment, and administrative orders and penalties. Through these modalities, the environmental protection is carried out through the public health laws. So these are the major domains, and we will see in the forthcoming slides and the more details about these modalities. So the public health law in public health emergencies of national and international concern. If we look at this public health emergencies, in all societies, public health authority is derived from the basic power of the state to preserve the health of its people. The constitution grant government broad, almost unlimited public health power because the constitution was evolved in the era of pestilence. The commonly in local language it is known as waba. On the other hand, they are basically the communicable and contagious diseases. The first cordon sanitaire, which is now known as lockdown, was thrown around the Pennsylvania in 1798 by the governor at that time and cut down the links between the New York and the Philadelphia. The cordon sanitaire that began around the Wuhan and two nearby cities in China on 23rd February 2020 to slow down the spread of COVID-19. This is the recent example of cordon sanitaire. The word cordon sanitaire is French literally known as the sanitary cordon. The administrative power for posing the restriction or cordon sanitaire are derived from the constitution provision of the state emergencies. So this is the basis and how the administrative powers of the state they are brought into action and evoked in favor of public health emergencies. Then what are the areas where the um, public health laws they are enforced and they compromises the autonomy and the privacy of the people? Uh, in disease surveillance, the case finding is done irrespective of the people consent, and the suspects are traced and they are forcefully treated. Tracing the contacts and the carrier and their treatment is through the implication of public health laws in case of public health emergency of both national and international concern. Then testing and treatment is obligation, specimen collection. The people in case of these emergencies they can't refuse for providing the specimen. Then testing and using the diagnostics and medications. Then the vaccination, quarantine, isolation, social distancing, use of masks, and travel restrictions. So, in all these examples, the public health emergency are evoked, and when these are evoked, then the personal rights of the autonomy of the people and freedom of choices they are transgressed. So this is the basic implication in case of emergencies, and usually the state administrative orders are the administrative powers they are brought into action for in case of public health emergencies. Then public health law for health and environmental protection. Um, the legislation in Pakistan in context of public health and environmental protections at various times. The Pakistan Local Government Ordinance, these are the examples. The Municipal Law 1979, Pakistan Local Government Ordinance 1979, Motor Vehicle Ordinance 1965 and Rules of 1969, Environmental Protection Ordinance and Act 1989 amended in 1993 and then lastly amended in 1997. Environmental impact assessments are done under the provision of Environmental Protection Acts. Pure Food Ordinance 1960 and Punjab Food Health Authority has been established through the Punjab Food Authority Act in 2011. And then registration of medical practitioner is done in pursuance of protection of the health of the people to maintain the quality of medical care. Now the national environmental quality standards have been set under the EPA Act 1997, and these standards are approved by the Pakistan Standard and Quality Control Authority, which is established under the Ministry of Science and Technology. And there are various examples of national quality standards, and these are here the national environment quality standards for motor vehicle exhaust and noise, national environment quality standards for industrial effluents, and national environment quality standards for industrial gaseous emission, and national water and quality standards. So all these standards, they are set under the umbrella of the acts. Now let's see these examples. Here you can appreciate the national environment quality for motor vehicle exhaust and noise. And here we have the parameters like smoke, and these are the standards limits they are set, and this is the mode of methods of testing. And then carbon monoxide and noise, these three things, these are the regulated things: the smoke, carbon monoxide and noise, and these are the limits, and these are the methods of measurement. Similarly, if we look at the national environment quality standards for industrial gaseous emission, these are the parameters like smoke, particulate matter, hydrogen chlorides, hydrogen fluorides, hydrogen sulfide, sulfur chloride, carbon monoxide, lead, mercury, cadmium, arsenic, all the regulated substances, they are put in the parameters, and then the limits are set. And these are the sources from where these emissions, they are tested. So these are the examples under the public health laws. These are regulated substances. If we look at the law enforcement tools and modalities, these are usually consist of 5 steps. In step 1, we have the protection of legislation through ordinances and acts. In second step, we set the standards to test the quality under the protection of acts and laws, and these standards, then they are the people, they are registered and monitored for licensing, provide permits for selling the particular goods which are regulated, and then monitoring and legal actions are taken, and then the judicial review, the contesting of litigations is done. So this is how and the law enforcement is being carried out. If we look at the first step, we have already mentioned there are acts and laws in Pakistan: Environmental Protection Act and Pure Food Ordinance, Pakistan Hotel and Restaurant Act. These are the acts they are providing the basis, and on the basis of these, the Pakistan Standard and Quality Control Authority (PSQCA) under the Ministry of Science and Technology is working, and they are approving the national standards. And when these standards are set, then the people are permitted to regulate routine activities that can pose the threat on human health. The registration of human resources is done, and permits and licenses are provided for like drugs and food items. When these standards are set, then monitoring schedules are provided. The monitoring under the for the legal action, the inspection of the regulated services and products are done. Then administrative orders are uh, injunction orders, and then penalties and punishments. And people have the right to appeal against the punishment or penalties. The litigations are contested by the monitoring authorities. So this is whole the enforcement legal process. We will see some of the details of this permit and licensing, and the administrative orders, injunctions, penalties. Let's see some of the details of these actions. And the permanent license and registration for regulation of routine activities that may pose threat to human health if they are carried out improperly. The authority laid down the standards of proper activity. Authority will monitor the set standards. Then legal requirement for permit and registration. Applicant must agree and follow the standards. Applicant must attain the standards. Applicant must permit to ensure the compliance. The penalties and the cancellation of permit and licenses or fines can be imposed to the licensees. Then regulatory inspections and monitoring, and they are carried out in for the water quality monitoring, inspection of sources, and specimen sampling for analysis of water contaminants. Food processing and eating places, inspection of eating places, the cleanliness and other requirements, then inspection of food processes, food sampling and nutrient analysis. Then environmental and public places, inspection of public places for standards of air, air and water sampling from these places. So these are the implication of public health laws in daily life and utilities. Then first is the administrative order in pursuance of non-compliance to the set standards. The orders directly issued by the public health agencies to individual agencies for action to be taken to mitigate the public health impact. These can be ranged from an order of clean up garbage from the vacant property to an order to show the tuberculosis treatment. The tuberculosis treatment certifications are asked in the people who are engaged in the cooking and other services. There may be a fine for violating administrative order, but most of the enforcement of administrative order depend on the cooperation of the affected individuals and businesses. So the affectees they will sometime report whether the compliance has been done or not. The public health agencies can use administrative order to empower private entities to act situation where they would otherwise be legally unable to act. The example is isolation and other follow of other SOPs. Like in COVID-19, the private hospitals, they were also empowered to uh, ensure the isolation and SOP for prevention of COVID-19. Administrative orders are most effective when violators holds the permit that may be suspended for not complying with the orders. So these are the administrative orders. Then other is the direct abatements. The public health department can act on its own where it has been given the authority to do so to abate a public health problem. For example, Food Health Authority in Punjab, Pakistan is empowered under the Food Health Authority Act 2001 to discard the harmful food items on inspections. Local government and municipal corporation of the large cities are empowered for direct abatement through their specific boards or agencies. Then fines and punishment. Persons who violate public health administrative order laws can be fined or jailed after appropriate legal process. In most public health cases, the fines are too small and to be like a warnings. The municipal fines and imprisonment are important enforcement tool for the state and environmental protection. The injunction orders are very important. The injunction orders are different than the other legal proceeding. It allows the court to give a specific order to what must be done or what is restrained. Public health agencies can enforce specific action through the injunction orders from specific courts. Courts can impose fine, imprisonment, or other coercive strategies to enforce the injunctions. Um, when a violator ignores administrative orders, when the violator has been confined but hazards has not been abated, when the public health agencies want to mitigate the hazard prospectively. So these are the conditions where the injunction orders are used for public health law implications. Then, as conclusion, there are major areas where the public health laws they are implemented in disease surveillance, quarantine, isolation, detention, travel restriction, vaccination, visa policies. So all these things they are covered in this domain in food surveillance, licensing and monitoring, food and nutrient surveillance, monitoring of food storage and processes. In environmental protection and safety, setting and monitoring the standards, regulation of hazardous substances, atmospheric temperature, ozone and climatic changes monitoring, motor vehicle and industrial emission monitoring. And the important area, public health, occupational safety. In occupational safety, the occupational surveillance is done, labor laws, social security insurances, hazardous trade monitoring is done in this domain, and monitoring of the process and industrial emission is done. So these are the major implication of public health laws. Thank you for sparing your time.